We've all been here before to get one of many vaccinations against COVID-19. While vaccines are great protection against viruses and other diseases, they can be a pain in the arm and hurt quite a bit. Vaccine hesitancy has been recognised by the World Health Organization as one of the top 10 health threats of today, and much of this hesitancy can be attributed to a fear of needles. Known as trypanophobia, this fear affects up to 2 in 3 children and almost 20% of adults. But what if there was a solution that meant you didn't have to feel anything while getting your immunizations?
And that's why we've come up with a device that we've aptly called Safety Vibes. Safety Vibes consists of 4 vibrating motors connected in parallel that can oscillate between 50 and 180 times per second. This is adjusted by a potentiometer knob that can increase and decrease frequency as needed. It works by simply strapping it to the patient's arm above the site of injection and adjusting the knob to reach the sweet spot of 100 Hz or thereabouts. Small, portable, and non-invasive, Safety Vibes ensures that you won't feel a thing.
Now let us tell you how this vibrating device can actually stop the crying babies. This device utilizes the gate control theory of pain. When people need to receive a jab, the pain signal travels from the site of injection to the spinal cord through A delta and C fiber. Then the signal ascends to the somatosensory cortex of the brain via secondary and tertiary neurons. The brain perceives injection as a painful stimuli. However, with prior non-painful stimulation of the A-beta mechanoreceptor, such as the vibrational sensation from the safety vibes, the noxious signal is inhibited at the first junction. An A-beta fiber signal sends a non-painful signal to the brain. Thus, the pain is not perceived by the patient.
But how do we know it's working? Well, we've conducted a series of verification trials to measure physiological variables and subjective pain relief from the device.
Our high-tech vaccine simulation tools, alligator clips, were used in combination with an ECG to measure heart rate and an EEG to show amplitudes of alpha, beta, gamma, and theta frequency bandwidths. These brain waves carry noxious pain signals as they travel through the patient's somatosensory cortex, that is, the pain hotspot of the brain.
ECG and EEG results showed a substantial reduction in heart rate as well as across-the-board smaller amplitudes of these pain signals in the brain, suggesting a combination of both pain reduction and anxiety relief. Patients also reported lower subjective pain ratings when the device was operating compared to without it, so instead of sharp, stabbing needle pains, all you feel is a numbing vibration.
With this device, we hope to reduce fear of needles among kids and adults alike, increasing vaccine compliance and thus protecting the most vulnerable members of society.